So in this video, we're really looking at the longer term impacts of the COVID-19 crisis on the treatment of chronic venous disease. Most people appreciate that even if the lockdown ends in the foreseeable future, the impact for our patients is likely to go on for much, much longer. So we've asked some leading experts for their perspectives.
We are seeing hospital-acquired VTE, and this is occurring in a situation where a COVID patient has really pro-inflammatory changes in their blood, really high levels of fibrinogen, factor VIII, ferritin, and CRP. So we will see acute VTE, and they would require 3 to 6 months anticoagulation, and we'd stop. They don't need long-term anticoagulation because this is profoundly provoked events. The question that we're not sure about is if we have patients who have severe inflammation in their lungs and they are getting small vessel thrombosis as a result of this, will it mean that down the line they might have pulmonary hypertension because they have thrombosed so much of their microvasculature? And it's difficult to know the answer to that one at this current time.
For venous patients in particular, we at least have the opportunity to monitor symptoms and look for deterioration. It's quite clear that most venous problems can be put on a monitoring phase, and even patients with leg ulcers can be stabilised in bandages during COVID with a view to treating these patients when the crisis passes.
In terms of what will happen once this is all over, not that it will be over, I think COVID is going to be with us for a very long time, one way or another, but certainly it seems the patients who survive, especially the severer versions, they're going to have a lot of ongoing problems, and many of them are going to be at risk of deep vein thrombosis and pulmonary embolism, so they may well need ongoing care from venous specialists for their both thrombotic problems.
There will almost certainly be a massive long-term impact on our ability to treat our patients with venous disease after this current crisis. It's difficult to see how there is going to be a lot of money or capacity in particularly state or even private healthcare systems. And I fear that we are going to be having the same battles that we've been having for many years, trying to elevate the treatment of patients with venous disease from the Cinderella category. But we've done it before, and we need to focus on the evidence and focus on the enormous quality of life benefits that we can deliver. And I think in due course, we will be able to get back to some sort of normality.